Hi, I'm Dr. Pete from Family Medicine of Pooler, and I'm here to talk to you about direct primary care. Actually, our talk today is going to be about, it's an educational video on diet and exercise recommendations. But I did want to give you an intro first and kind of give you a disclaimer. The disclaimer is that this is not medical advice. This is specific to every patient is different, and so they're just general guidelines. So don't take this as medical advice. Ask your physician before changing anything in your diet or exercise. So with that disclaimer aside, we are Family Medicine of Pooler. We're located in Savannah, Georgia. We are the first direct primary care practice here, which essentially means that we don't accept insurance. We charge a low monthly fee instead, and it includes everything, all your direct primary care needs with that monthly fee. You can learn more about it on our website because I'm not going to talk about that today. What we're going to do today is talk to one of our patients who is here to learn about diet and exercise and kind of learn from Dr. Ghaleb is going to be speaking to us about some of her recommendations. So if you will follow me, we will first meet the patient.
Hello.
Hello. How
Hi.
are you?
Good. How are you?
Dr. Pete. Nice
Hi.
to meet you.
Nice to meet you as well.
And what's your name?
My name's Vanessa.
Vanessa. Okay, Vanessa, you have agreed to do this on Facebook Live, which
Yes.
is right over here.
Mm-hmm.
So, have you been doing direct primary care? Is this your first visit, or is this
This is my first visit
Yes.
under this type of.
under this type of thing? So I can't
Yeah.
really ask you yet how your experience. Well, maybe. How is your experience with this? Is
So far so good.
So-
I don't feel a difference.
okay, the whole camera. You haven't had the camera thing before, have you?
No.
Okay, that's not part of direct primary care. So, Dr. Ghaleb is going to be speaking to you about some diet and exercise recommendations. Which I don't know. Were you in our a patient from before?
Yes.
You were. Did she ever speak to you about?
Yes.
Okay.
Yes.
Well, good. So this is much like the same of what she did before. Okay,
Yes.
so I'm going to invite her and kind of introduce her as well.
Okay.
So this is Dr. Christi Ghaleb,
Hello.
and she is going to be giving some of the recommendations as I mentioned. So go ahead.
Yes, okay, so diet and exercise is very important, and the first thing it comes down to is that you want to make sure that you're doing some type of exercise that you like to do. Like, I am not a runner, so I definitely don't run. I know that you like to run and walk. So find something that you like to do, you know, either swimming, walking, running, tennis, just to get out there, enjoy the nice weather that we're having. And you want to exercise at least 150 minutes per week. You want to make sure that you're getting that heart rate up when you're walking and running, and make sure that you're drinking lots of water too. So exercise is part of it. And then we also have our diet recommendations, and I have this little sheet that talks about some diet recommendations, and I broke it down into weeks, but you can choose whichever week that you want to do.
Mm-hmm.
And my recommendation is not to try to do everything at one time, because when you try to do that, you're just going to be a disaster and fail. So just try one little thing at a time. So the first week is just you want to decrease your sugar beverages to less than 36 ounces per week. So that's not very much sugar at all. So you just need to watch that sugar intake. Week 2 is that you want to eat 4 flat handfuls of nuts per week. So you don't want a whole handful, just enough to fit the palm there. And you want to make sure that the nuts are the nuts that are going to come from trees. So that's going to be your almonds and your cashews, not peanuts from the ground.
Okay.
And you want to make sure that they're not the smoked almonds with the candy and everything on there, that they're the good, plain, healthy almonds. And watch your sodium intake, less than 1,500 milligrams a day. And the sodium really sneaks up on you because Diet Coke has 60 milligrams of salt or sodium in it. So a lot of processed foods have it, your canned foods, so just watch your sodium intake. Try to eat 2 days a week of some fish. You want to make sure that you limit your processed meats. Increase your fruits and vegetables. And then watch out for your saturated fats. You want less than 7% of your total calories to saturated fats. And I put some examples of your saturated fats are going to be your fried, fatty, fast foods, greasy foods, anything that's going to leave a stain on your paper towel or the greasy feeling on your finger. Watch out for butter, cheese, to baked goods. So everything you were eating on your cruise, basically.
Pretty much.
I know, right? That's vacation, though. That doesn't count. And then you also want to make sure that you're eating fiber-rich foods per day. And this is pretty easy because a lot of things have fiber in it. A lot of your breads do. You can have the over-the-counter supplements. Cereals are fiber enriched as well. So this is just kind of a little basic thing that works for some people, doesn't work for others, but if you can kind of find the right combination of stuff with your diet and exercise, it really helps with kind of tighten things up and helps with weight loss.
Great.
Okay.
Yes.
All right. Thanks.
Well, thank you for letting us share. What we're going to do is let them finish the rest of their exam in privacy. And I'm going to take you over here for a minute. Okay. All right, so I just wanted to introduce you to our new nurse practitioner student, Kelly. And I just wanted to ask you, Kelly, what you thought of your experience with us in direct primary care.
Oh, I absolutely love it. I love the way that it's set up. I love how she's able to take her time to really get to know patients and provide them care emotionally, physically, mentally. The patients seem to really love it, the rapport that they build with her, the fact that they can get a lot of their medications here, which are wholesale and less expensive than a lot of times what their insurance provides. Their labs are a lot of times less expensive than what their insurance would cost them. So, I mean, it's really impressive with what's been going on here.
Okay, well, thank you so much. So I just wanted to introduce you because we have a new nurse practitioner student, and so wanted to get her perspective on it. But those are diet and exercise recommendations, like we said. Consult a physician beforehand, but a little bit about direct primary care. As you saw a little bit more on there. We'd love to take your questions, or visit our website, www.familymedicineofpooler.com, or like us, and stay tuned for future videos. Thank you.